So this is on personal injury. Hey, I'm just going to skim across the top because this is a really big subject. It's an entire practice unto itself within chiropractic, and it should be. Personal injury is medical legal or med legal. So there's several more components to a personal injury case in chiropractic than there is in just a normal chiropractic case. Typically there's trauma involved. Trauma is a whole different category that needs to be managed, as opposed to somebody who has back pain or neck pain because they sat at their desk too long for the last 5 years. These people are in violent crashes, so their injuries can be really serious. You need to know how to triage those. Typically people are going to go to an urgent care or an ER. They're going to get worked up there. Imaging typically. They're going to make sure there's no fracture, dislocation, or major growth pathology. And then those providers will tell the patient, hey, you're good, and send them on their way. What they really mean is that there's nothing that's going to kill them, right? Or nothing that needs immediate surgery right now. But almost none of those patients are okay. And so by the time they get to a chiropractor, it's been another 2 weeks and they're in so much pain they don't know what to do. And then you need to triage them from there and set up a very specific care plan for them. The documentation has got to be tight. Your referrals for imaging, for pain management specialists, sometimes for psychologists, right? Because these people are so traumatized. You've got to have a really good network in place. Typically, you've got attorneys involved. You've got to be able to communicate with these attorneys. They've got to understand your documentation. That documentation has got to stand up in court. You can't over-treat. You've got to make sure that your treatment coincides with your diagnosis, which coincides with whatever you're charging, and it's kind of a big thing. So again, it's a bit of a beast. I've been doing it a while. The better part of the last 8 years, I've been doing it pretty concentrated, and I'm good at it. But it's a whole different thing. If you have patients that have been in car accidents, they do not want to be going to a provider that does not know how to deal with personal injury cases, because they'll end up with big bills and no way to pay them, unfortunately. So that's it.